My story is personal. Why am I doing harm reduction and naloxone? The bishop of the Anglican Church calls me Captain Naloxone. And how that started was actually in 2012 when we owned Rx Pharmacies. I dispensed a fentanyl patch to a dying cancer patient. That cancer patient in turn sold that patch to a 19-year-old romantic who overdosed and died. If they had naloxone there at that party, he was there with his brothers, he would be alive. They would use naloxone to save his life. They didn't have it. And so I made it my mission then to make sure nobody else died. I felt personally responsible. Since then, I developed the Patch for Patch Return program, which is now a law in Ontario. It became legal in 2014. We've done a ton of work. I work in all kinds of different levels of government with regards to harm reduction, naloxone and its use. But more specifically, today I want to focus on Ottawa. I want to focus on most large urban centers in Canada that are actually like Ottawa. I can talk about provincial legislation, federal stuff, but really what's the biggest focus is what's happening at our treatment centers. We have 4 locations, one in Cornwall, one in the Byron Market, one in Bell's Corners, one in Vanier, soon to be one in Kingston and Ottawa South. So we have access to about 3,000 people who are addicted to opioids every day. So I want to give you the perspective of someone who's actually battling with this disease every single day and what it's like to actually go through the disorder a little bit and why naloxone is so important for every citizen of Canada to have, really. Okay, so I'm going to share my slides now so you guys we'll whip through these quickly. I know it's been a long conference for you guys, but I want to make sure you guys get this information. Okay. First and foremost, what are opioids? What are we talking about? Now, I'm going to pretend everyone hasn't even heard about this stuff or what this is, but opioids are painkillers, okay? So when we talk about opioids in general, we're talking about hydromorphone, morphine, codeine, Dilaudid, Percocets, OxyContin. They're all opioids. The gold standard for opioids is actually morphine, named after Morpheus, the god of sleep, right? And the most famous street opioid that we hear about in all gangster movies forever is heroin, right? H-train, as it's known on the street. And people still talk in large urban centers in Canada about heroin. I use purple heroin. I use brown heroin. I'm on heroin. But really, there's not much heroin left in Ottawa. There's really no heroin left in large urban centers in Canada. When they talk about down, though they call it heroin and they speak about heroin, really what we're speaking about is actually fentanyl. So fentanyl is not a bad medication. I'm not here to tell you that fentanyl is bad. We use fentanyl every single day in modern medicine, okay? We can't do our jobs as clinicians without fentanyl, right? More often than not, fentanyl is used to sedate people for surgery, to be able to do, anesthesiology, and also for advanced cancer pain, right? So if you've gone to sleep for surgery, then you've used fentanyl. If you've had an epidural during childbirth, you've actually used fentanyl. We even use fentanyl for dental extractions, okay? Now, when we talk about the strength of these things, fentanyl is actually what's on the streets in Ottawa, but it's not necessarily the prescription fentanyl in the patch form where you see on hospital grades. It's actually illicit powdered fentanyl, but it is still fentanyl. The strength of this stuff, fentanyl is 100 times stronger than morphine per milligram strength. There is also another animal in large urban centers in Canada and is in Ottawa called carfentanil. Carfentanil is actually 100 times stronger than fentanyl. So essentially 10,000 times stronger than morphine per milligram strength. I often say I would love to go back to 2012 where OxyContin was the biggest animal on the street. Way easier to manage. But now we're talking about something that's 10,000 times stronger in fentanyl and carfentanil. And this is why so many people are dying. Everyone will be getting this mailed to them, hopefully from me. It says here, anything can be cut with fentanyl and carfentanil. So not only do we have an opioid crisis in Canada that's done with prescription opioids, we also have a chance of these toxic chemicals like fentanyl and carfentanil being cross-contaminated in all drugs. So if you use cocaine, even street source marijuana, Molly, ecstasy, all street drugs can be laced with opioids. And that's the problem. And that's what we're battling right now, and why there's so many deaths in Canada. So what is an opiate overdose? What actually is happening to the body when someone is overdosing? Well, let's mention it a little bit earlier there. We use opioids to put the people to sleep for surgery. Count backwards from 10, 9, 8, 7. You are completely unconscious, right? Not only do you go unconscious to do surgery, what happens then is that a nurse rolls along and will intubate and ventilate you. They'll stick a tube down your throat and hook you up to a ventilator. We all know about ventilators during COVID, right? So that's what happens because you cannot breathe on opioids. So not only do opioids kill pain and sedate you for surgeries, it actually turns off your breathing mechanisms so you can't breathe. So essentially, an opiate overdose is you stop breathing. It's equivalent to taking a plastic bag, placing it over your head and taping the neck. All the mu receptors, which are your morphine receptors in the brain and spinal cord, get saturated with the opioid. You become hypoxic and then you die. From the time you take a hit or accidentally consume an opioid till the time you're dead can be as quick as 3 to 5 minutes. Most people die of an opiate overdose with sirens in the background, paramedics en route because someone didn't have naloxone there to intervene to prevent the death. This is Canada. If you don't know this is Canada, you are automatically removed from the Ottawa University. I'm just kidding. I don't have that power. Okay, so this is Canada. So what this represents is the number of opioid deaths in 2019. 3,823 Canadians died of an opioid overdose in 2019. Okay, this lets us know that Canada is actually the epicenter for opioid overdose in the world. We are one of 2 terrible, terrible nations. Okay, and Canada per capita is actually highest than anyone else, right? And as you can tell by the numbers there, Ontario is the epicenter of Canada. So we are currently sitting in one of the worst places for opioid overdose in the world. It's terrible, right? That is Canada. It is truly an epidemic happening in the face of a pandemic. Okay, it's terrible. And this is 2019 numbers. When I showed this slide for 2018, it was worse. We had lost 4,400 Canadians in 2018. And actually, since 2016, we've lost almost 16,000. Okay, that is terrifying. Now, how did we, and some of the statistics are there as well, 94% were accidental, mainly male, 30 to 39. Most of them are housed. It's not homeless like you think you see on the street. 68% of people actually live in housing. Okay, it's no issues there. But what we're looking at here when we look at this here picture, okay, and how do we actually slow it down from 2018 was massive amounts of naloxone distribution. Okay, it was advertising by the government of Canada in 2019 about opioid crisis. It was people doing work just like this, having conferences like this, where they're learning about naloxone. This is what slowed the rate of death in 2019 over 18. Unfortunately, the only province that grew in 2019 over 2018 was Ontario. Though the rate of growth was less, it's still becoming worse in Ontario than ever, right? Roughly, what we're looking at now is probably Ontario taking over BC as more overdose deaths than anywhere else in Canada, which is actually terrible. We have 1,535 deaths, right? Now, all that work we did in 2019, including the government spending mega dollars putting opioid commercials on during Hockey Night in Canada's Maple Leaf games, which is expensive. What we actually have done in 2019 has now all been reversed. In 2020, we're expecting a 25 to 35% increase in opioid overdose deaths. I'm really anticipating 5,000 people to lose their lives from opioid overdose in 2020. That's terrifying. Why? Why is this happening? I mentioned it earlier. There is an epidemic of opioid overdose in the face of a pandemic. In 2018, the Minister of Health in Ontario actually declared a state of emergency and opened up funds to try to treat the opioid crisis. Now in 2020, we're going to have to do it again. It is going to be terrible, right? We're expecting almost 5,000 people to die across the country, right? And this is because of COVID-19. If you think about it, fear, isolation, anxiety, and money through CERB has led to more opioid overdose deaths. I'm not sure about you guys, but like during COVID, I definitely drank probably more beer. I ate more crappy food, maybe for comfort, for whatever. We were at home more. So if you had an opioid use disorder, what did you do? You use more opioids. And we asked you to use them alone, not with anybody else. So you probably overdosed, right? It's actually terrifying. And that's what's happened in our society. Other kind of weird statistic for this province is that 1 in 3 in the construction industry. That industry is overrepresented compared to others for opioid overdose deaths. Now, if you look at the naloxone distribution across the provinces, across our province, as you can tell, Ottawa has 38.1 kits put out per opioid harm. That's amazing. We actually have the highest naloxone distribution for opioid harm anywhere else on the planet, is right here in Ottawa, through Ottawa Public Health, through people like myself, through Rx Pharmacies. We are doing a wonderful job of getting the kits out there. Sort of. And the reason why I say sort of is, yeah, we're the best. We're 38.1. But when I talk to the coroner in Ottawa, because I sit on the overdose task force, I said, hey, how much naloxone are you finding at overdose deaths? So we lost about 80, I think it was 82 people in 2018. And the coroner's office then told me that, like, listen, Mark, we're only finding naloxone in 1 in every 4 opioid deaths. So if I'm the best at 38.1 out there in the community per opioid harm, but I'm only hitting 1 in 4 opioid deaths, how much naloxone does our society have to put out there in order to catch everybody? A hell of a lot more than we're doing now. And this is why it's so important that everybody at this conference has naloxone in their home. 3/4 of opioid overdose deaths aren't street use. 3/4 of opioid deaths in Ontario are linked to prescriptions. That's terrifying. Lots of these things are diverted. And we talk about opioid overdose deaths a lot, about street use and fentanyl, street fentanyl injection and safe consumption sites and all that stuff, which is all relevant, yes. However, if a grandmother makes a mistake with her own prescription and overdoses, the answer is still naloxone. If a baby crawls across the floor and gets access to a vial of tablets and takes one and overdoses, the answer is still naloxone, right? If, a dog consumes opioids, it's still naloxone. It doesn't matter. We talk about opioids, we talk about street use, but really this is a society problem. We put out hundreds of millions of opioid pills per year in Ontario. It's the highest anywhere on the planet again. We have a lot to do to make sure that we correct this problem. And if we have so much opioids in our community, we need to have a hell of a lot more naloxone out there. With regards to opioid overdoses versus COVID-19, I'm not here to tell you that one problem is worse than another, but this is just some information from BC. Opioid overdose deaths versus COVID deaths in the first few months. The blue is COVID, the red is opioids. And we are spending billions on COVID-19. The other statistic I can put up there that's worse is our suicide rate among our Indigenous populations in Canada is staggering. Very resilient people who've been through mega trauma in their lives, and reconciliation is happening. We're working on things, we need it, but really we're pulling money and tons of it into COVID when there's other social problems we need to worry about. And this last slide here shows you that the ER visits for opioid overdoses are higher than ever in history, right? Which means, this is Ottawa data, which means that more people are actually reaching emergency departments because of naloxone, okay? It's not just dead bodies coming in the hospitals anymore. It's actually people making it to ER to make sure that they can actually be saved. Naloxone will keep you alive to do that. It is so wonderful. And we're higher than ever in history now, which is really good. Ottawa Public Health gets 2 calls per day of someone who used naloxone to save a life. I get the calls. They warm my heart. It's amazing. I get calls from students. I get calls from case managers. I get calls from social workers, from bus drivers, from security personnel to Ottawa Community Housing. I get calls all the time about, hey, Mark, I've been to your training seminar. I use naloxone. It's just like you described. I saved someone's life. It's amazing. All right. So if I'm going to make all you guys superheroes as well, then how we're going to do this is that we got to know about the signs and symptoms of opiate overdose. Okay. This stuff can all be found on this website here as well, stopoverdoseottawa.ca. Everybody at this conference, I would love to send you guys 2 naloxone kits directly to your home. We'll find out how to do that at the end of the conference, or at the end of this, you'll get an email. But you're also going to get this card come in the mail. And on the back of the card talks about the signs and symptoms of opiate overdose as well. Okay, so sit back and listen. You don't need to take notes. This is being recorded, and you're getting this card in the mail. The first symptom is decreased level of consciousness. Now I'm going to go over all the symptoms in the literature. Okay, and this literature is based on Dilaudid 20 years ago. So I'm going to go over all the relevant stuff that you'll see that's in the literature. And then I'm going to talk about what we actually see today on the streets. I left our treatment center this morning. This stuff is relevant to today. So the first symptom in the literature is decreased level of consciousness. Now that's a very silly way to say that you're ready for surgery. Okay? I can do a knee replacement on you in an opiate overdose and you will not wake up. The guardian angels that work in harm reduction and safe consumption that you just spoke to will tell you that the difference between overdose and someone who's comfortably high on an opioid is their ability to respond to stimuli. So the minute they can't grunt, groan, lift a finger up, that is opioid overdose. You'll have to shake somebody because they will be unconscious, ready for surgery. Guys walk into our pharmacies and their faces are mangled, black eyes, broken nose. I'm like, whoa, what happened? And they're like, I went on the nod last night. My buddies tried to wake me up, which means they wailed in their face to try to wake them up. We don't recommend that medically. We stopped that last year. Nobody does that anymore, okay? But that's how unconscious the people are. The next symptom is pinpoint pupils. The black pupil, part of your eye, almost becomes non-existent. Bright blue and green eyes, very distinctive. You'll look like a zombie. If anyone's fans of Walking Dead, kind of what you look like. All you can see is the color part of your eye. The black pupil is almost non-existent. Darker eyes, harder to tell. Then there's a deep snorting and gurgling sound. Okay? This is the body gasping for air without the mechanical ability to breathe. So basically, it's you gasping for air without mechanical ability to breathe. You're making this gurgling sound. In palliative care, this is known as the death rattle. It's the same sound you would make if I took my hands, placed them around your neck and choked you out, but there's no hands around your neck. Then your lips turn blue and your fingernails turn blue. Then your whole face turns blue, your hands turn blue. This blue color can be gray. If you are Black, Indigenous, Middle Eastern descent, dark complexion, it could be more of a gray color. If you're fair skinned, you know, red hair, blonde, blue eyes, it's probably more of a blue color. The body's limp. If you don't mind, I'll skip over that because we're ready for surgery. We understand that. The next symptom listed is vomiting. Now, vomiting is listed in every single opiate overdose monograph. However, it's not really vomiting. You do not have the muscular capacity to vomit. You've taken carfentanil and fentanyl, something that's 10,000 times stronger than morphine. When I trained 911 responders about this, they said, Mark, you know, on opioid calls, we hear not vomiting, we hear foaming at the mouth. What it is, it's a white cottage cheese type foam stuff that comes out of the mouth. That's what it looks like. That's what it is. And the last symptom there on the left-hand side that you see is shaking. This is a neurological response caused by rapid decline of oxygen in the muscle cell. On the street, known as the funky chicken, okay? This is not listed in hardly any monographs, and it's in one case report out of BC. That's it. However, it's seen in every single opioid overdose right now. And Hollywood does a great job of depicting opioid overdoses with this symptom of shaking. So these are all the symptoms of opioid overdose. The four we see more often are pinpoint pupils, pinnies, blue lips, gurgle, and chicken. That's it. That's the ones they talk about more often. I've given out 75,000 naloxone kits. For every 25 kits I give out, one is used. I guarantee you, if I can give out 25 kits in this call tonight, tomorrow, the next day, someone's going to save a life with these kits. But because I put out so much, I've got a lot of feedback about what we're actually seeing. This is what we see. Pinnies, gurgle, blue lips, and they start to shake right before they die. That's what you need to recognize. Now, people talk about who's at risk of opiate overdose. And on my earlier slide, I talked about male, 30 to 39, summer house, construction industry. We can talk like that. And I can give you all the medical risk factors. I really like to focus on the street perspective risk factors. And that what this is what this slide is. This because I find medical risk factors gives a false sense of security of who really is at risk of an opioid overdose. And in Ontario, because of the massive amount of opioids we have out there, every single person in Ontario is at risk of an opioid overdose, whether it's illicit drug use, prescription drug use, misuse, whatever. Even codeine cough syrup in a drug called lean is used in high schools. It is everywhere, everywhere. So let's talk about the risk factors. The first one I like to talk about is loss of tolerance, such as that baby who crawls across the floor, who consumes a tablet, has no tolerance. Tolerance is your ability to handle medications over time. Okay, we build up tolerance all the time. It happens. You're on opioids for 3 days. Day 4, you need more of them to get the same high you had on day 3. However, again, if you don't use opioids for 3 days, then your tolerance is gone. You're at risk of overdose. So in the legal world, people post-incarceration are at high risk of opioid overdose. You've been remanded to custody. Sorry, you've been picked up and an outstanding bench warrant on Thursday. This is my clients. This is what happens. They go in, they don't see the judge till Sunday. They get out Monday morning, whatever. They're out and they use the same amount of drugs they use on Thursday. They overdose and die. This happens often, okay? Or a grandmother who's dehydrated because she has a stomach flu and her Percocets for osteoarthritis make her nauseated. So she doesn't take them because she's sick Monday, Tuesday, Wednesday. But on Thursday, come hell or high water, she's going to bingo. She takes her Percocets and she overdoses, right? These happen all the time. Or if you think you were doing a lot of cocaine and it had fentanyl laced in there, you will die. You were not expecting to have that opioid. This is why it's a problem. Other medical problems as well lead to risk of overdose. If you have breathing difficulties. Now, what in the world right now is causing breathing problems? COVID, right? So there's a risk factor for opioid overdose, asthma, COPD, other mental health disorders, complicated medication regimes that affect kidneys and liver. These are all risk factors for opioid overdose. If you use alone, it's a risk factor for opioid overdose. What in the world today have we asked people to stay alone for? COVID, right? Same thing. We've asked people to self-isolate. They're using these drugs alone and they're overdosing. This is what's happening. The message to kids and youth out there is never use alone and carry naloxone. And if you've had a previous overdose, so you've had a client or a friend or family member who's had a previous overdose to any substance, more often than not, they will overdose again. Now, why is that? That lends itself to opioid use disorder. First and foremost, it is so important, and I know you guys have this philosophy already. Opioid use disorder is not a character flaw. It is not a moral insufficiency. Opioid use disorder is a true mental health disorder. Okay? Opioid use disorder is not a choice. If you get addicted to opioids and you have the underlying complex mental health issues, you will have a hard time stopping them. Why is that? It's because opioids, though they kill physical pain, of all drugs on the street, and most drug use will actually pillar to opioids if you're using drugs for this reason, okay? Of all the drugs on the streets, opioids do the best job of killing mental pain, okay? So if you've had flashbacks from trauma, such as childhood rapes, such as paramedics seeing kids burned to death in cars, screaming for help, and they can't save them, or our lovely military who go overseas and see travesties in other countries and come back with these flashbacks, okay? If you have that trauma and been through that trauma in your life, the best drug out there to turn off those flashbacks mentally are opioids. People who use them describe the hit as 3 terms used most often: liquid caramel, a warm blanket, and a warm hug. When they take the drug, they call it a hug. That's the only time in their day that they don't have those flashbacks. The problem is where the hug is the tightest and the blanket is the warmest is about 2 breaths per minute. They are almost dead. And they go there once, they'll go there again and again and again until they fix the complex mental health, post-traumatic stress, trauma, disorder behind the scenes. People use opioids 5 times a day on average. They get high 5 times a day, which means they could overdose 5 times a day. And it takes up to 15 years to treat a mental health disorder like this, where they don't turn to the drug for the coping mechanism. So we've had patients who've used naloxone hundreds of times just to stay alive. That's where we are in society. Now let's take that risk factor, okay, and let's add it to the drug factors. The drugs are stronger than ever. You cannot trust your drug dealer anymore. The routes of administration are getting more creative as we have vaping machines and those kind of things. And everyone drinks with this stuff now. This slide will show you how strong these things are. This is known as LD50. So lethal dose 50% of the time. So if everyone on the call today took that much heroin, half of us would die. That ruler on the right-hand side is 1 inch. If everyone on the call today took that much fentanyl, half of us would die. If everyone on the call today took that much carfentanil, which is in Ottawa, which is in most large urban centers in Canada, half of us would die. That stuff is cross-contaminated in everything. Now, enough doom and gloom. It's Friday afternoon. It's been a long conference for you guys. I'm going to power you guys today with something that's going to save lives. It's known as naloxone. Here it is here. Okay, naloxone. What is it? So naloxone itself is an antidote for opioid overdose. You got to think of naloxone as Narcan nasal spray as the EpiPen for opioid overdose. So like an EpiPen used for allergies, this is used for opioid overdose. Like an EpiPen, which can't remove peanuts from the body, naloxone cannot remove opioids from the body. What it does, it temporarily goes into the lung and brainstem, removes the opioid off that lung and brainstem for a short time to allow the body to breathe until paramedics get there. Okay, but the overdose will come back. It'll take days to get over the opioid overdose. It will come back. The person will slip back and overdose and they will die unless you call 911. Each nasal spray is already primed, ready to go. It's 1 spray per device, and it takes only 2 to 4 minutes to start working. And the most wonderful thing about naloxone, of all things, is that the person doesn't even have to be breathing for it to work. It is like a miracle drug. So bear with me. It's like Walt Disney made naloxone nasal spray. Prince Charming, AKA pharmacist, rolls in to Sleeping Beauty, who is dead. 1 spray in the nose, she'll wake up. It is like a Walt Disney thing. And that's how creative it is. It's very low invasive. It's just a nasal spray and it can work in 2 minutes. Now, a lot of people are really concerned about using naloxone for 2 reasons. A, am I in trouble? So first of all, as all you guys are in, you know, this is like a law conference, whatever. The Good Samaritan Act in Ontario says the words opioids and naloxone in it. You can use naloxone without fear of doing it wrong. You can use naloxone without fear of the person dying or not dying. No worries. You are not subject to any litigation from using naloxone in an opioid overdose situation. The second thing is you're not in trouble for calling 911. There's never been a paramedic called to testify in a drug trial in Ontario's history. Okay, so that's really important to note. You can call 911 and not get in trouble for simple possession of a narcotic, use of naloxone, and any other drug crime, right? As well as I think some other stuff like breach of parole and those kind of things. But there are some severe crimes that you are going to be subject to problems, but nothing to do with the drug use itself, which is really wonderful. It's why kids have to know, never be afraid to call 911. The second thing is, you just described, Mark, you just described to me that they call this a warm hug. I'm not taking their hug away. I'm not ripping the blanket off them. So I don't want to use naloxone. That is overplayed in the media. The side effects of withdrawal from naloxone are overplayed because, let's face it, the opioids we're talking about now are 10,000 times stronger than morphine per milligram strength. Some guys, 1 spray doesn't even work. Other times the person doesn't even regain consciousness. They're just breathing better, okay? The next thing you need to know about naloxone is that the literature always talks that it lasts about an hour. It does not last an hour anymore. Okay. Some guy told me today he got 15 minutes out of it. That's it. And that's a nasal spray. But really, the average is 20 to 40 minutes. You got to go to a hospital. You have to call 911. And even if it's not an overdose and you gave him Narcan anyway, it is completely safe. It is the safest thing that I will give out in a day as a pharmacist. It is safer than the toxins found in a pregnancy test. It is, I can't think of anything safer. I could Narcan myself right now and nothing would happen. Okay. There's no contraindications really besides having allergy to naloxone, which I would give it anyway, because in an allergy situation, your blood pressure and heart rate goes up and paramedics are coming with epinephrine anyway. So I would give naloxone. There's no situation which I would not give it. Okay. Even in pregnancy. So let's talk about the procedure. So what I'm going to do here quickly is go to my website called naloxonecare.com, and I'm going to show you a quick training video that you guys will be able to show how to use naloxone. Then we'll come back and I'll show you how to use it in person.
In 2018, 1 Canadian died every 2 hours from an opiate overdose, and this number continues to rise. It's not just heroin or fentanyl users in the streets, it's grandmothers with their own prescriptions, and kids who didn't even know they took an opioid. My name is Mark Barnes. I'm a pharmacist and the owner of Naloxonecare.com, an interactive website designed to allow more Canadians access to life-saving drug naloxone. Naloxone is the drug that's found in an easy-to-use Narcan nasal spray. It can reverse the effects of an opiate overdose in as quick as 2 to 3 minutes. After you complete a simple training and answer a few questions on this website, we can send you a Narcan nasal spray kit directly to your home. So what are opioids? They are painkillers such as codeine, morphine, OxyContin, Percocet, and fentanyl. Recently, much stronger powdered fentanyl and carfentanil are leading to accidental use and overdose because they are so small and hard to detect if mixed with other drugs. With this Narcan nasal spray antidote, you can deliver 2 milligrams of naloxone directly to the bloodstream. Although naloxone can reverse the effect of an opiate overdose, it cannot remove the opioids from the body. It's important to call 911 after you administer the spray, because in 20 to 40 minutes, the effects of naloxone will wear off and the person will slip back into overdose. The time it takes when an opioid is ingested to overdosing and death can be as quick as 3 to 5 minutes, which is why it's so important to recognize the symptoms quickly. Here are the 4 major symptoms of an overdose. Unconsciousness. The person is not moving and cannot be woken up, even if you shake or pinch them. Pinpoint pupils. The person's pupils are small and hard to detect. Snorting or gurgling sounds. The person can be heard gurgling or choking, and breathing is shallow or undetectable. Blue and gray lips. The person's lips turns blue or gray. Other symptoms include cold, clammy skin, foaming at the mouth, and shaking. Every naloxone kit you order from naloxonecare.com includes a case, latex-free vinyl gloves, a CPR mask, 2 doses of Narcan nasal spray, an identification card letting everyone know that you've been trained to use naloxone, and instructions. We like the 5-step approach to respond to an opiate overdose. Step 1, shake and shout. Assess the person and remember the major symptoms of an overdose. Step 2, call 911. If the person is unresponsive, call 911 right away. Step 3, administer the naloxone. Lay the person on their back. Remove the device from the packaging. There's only 1 dose per device, which is ready to use, so do not test or prime the device. Tilt the person's head back and provide support under their neck with your hand. Gently insert the tip of the nozzle into the nostril. Your fingers should be right up against the nose. If giving to a child, make sure the nozzle seals the nostril. Press the plunger firmly with your thumb to give the dose. Remove the device from the nostril. Step 4, chest compressions. Start CPR as it takes 2 to 3 minutes for naloxone to start working. If you have an AED, use it. If not, push on the center of the chest. This pushes any of the oxygen left in the body to the brain and circulates naloxone to the areas of the brain and lung to start working. Step 5, is it working? If you do not hear a deep breath in 2 to 3 minutes, then go back to step 3 and administer a 2nd dose of Narcan nasal spray found in your kit. Once the naloxone is actively working and the person is breathing on their own, put them in the recovery position. The recovery position helps open the person's airways and avoids choking on vomit or spit. Remember, naloxone only lasts 20 to 40 minutes, so an overdose can return. It's important to get the proper medical treatment. Tell paramedics everything you know about the situation so they can provide the best care. Get trained, get a kit, save a life.
Great. Okay, so quickly to go over it again. Naloxone itself, okay, guys, Narcan nasal spray. Your kits come with these little things here. Everyone should get a kit. Absolutely mandatory, as far as I'm concerned, in Canada to have one. This is Narcan nasal spray right here. Okay, so let's go over the steps quickly again. Step 1 is you do your assessment. Pinpoint pupils, gurgling, blue lips, blue or gray lips, and shaking. You see those things? It is definitely probably an opioid overdose. Even if you're wrong, it doesn't matter. You call 911, you say, hey, I think it's an opioid overdose. It's a big deal. They're coming. The other thing too is 911 responders, put them on speakerphone, lay the phone down next to guys overdosing, because what's happening is they're going to walk you through giving naloxone as well, which is very important to note. You take your naloxone out of your kits, you open them out of the plastic. They don't work unless you open them. So important. Naloxone itself, as you can tell right here, okay, it has 2 side pieces, which are what you hold on to, and a plunger in the middle, just like the video showed you. You grab it, you place it in the nose. When you place the nasal spray in your nose, you put it in the nostril and you twist towards the eye. Same thing goes to the other side, towards the eye. And the reason why you place it towards the eye is that your sinuses are actually holes behind your eyes. So you want to make sure you get it there. Then you place it in there. Let's pretend this is in my nose. I'm going to spray it. Boom. As you can tell, the stuff shot about 2.5 feet in the air. Inside my nose, that is coated the sinus. The device has now been used. The plunger does not come back down. Inside, you puncture the canister. There it is there. It's gone, empty, done. We want this to start working in 2 minutes, not 4 minutes. So we delivered it to the body, but we want it to work in 2 minutes, not 4 minutes. So we're going to help it along by doing CPR. I'm not here to train you in CPR, nor I'm not allowed to do it actually. However, I will tell you that during COVID, it's recommended we don't do rescue breathing. And to be honest with you, before COVID, me and my docs that work at the clinics with us, I said probably not using breathing anyway. St. John Ambulance recommends breathing. Some people don't. In Ontario, all I know is I want you to use an AED if you have it, or push hard and fast on the center of the chest. And the reason why we push hard and fast on the center of the chest is that we're delivering the valuable oxygen left in the bloodstream to the brain, but we're also delivering Narcan fast, quickly to the areas that needs to work. And when it kicks in, you're going to hear a sound that's heard in every single opioid overdose reversal. You'll hear this, a big gasp for air. If you do not hear that big gasp for air in 2 to 3 minutes, you grab a second nasal spray in your kit, you place in the other nostril, and you spray again. So how it looks is that you have done your assessment, you call 911, you do naloxone, chest compressions for 2 minutes, naloxone, chest compressions for 2 minutes, naloxone, keep going until a paramedic tells you to stop. More often than not, people will wake up after one spray, especially if it's an accidental ingestion. Otherwise, you keep going and give them naloxone until they jump up and give you a kiss. That's how it's done. So important. That is how you use naloxone more and more effectively, and that's the 5-step approach we like to use in Ontario. Point 6, which is not often identified in any other training, is that you have just been through a traumatic event. You want to reach out for your own mental health support, okay? Don't downplay how traumatic the event was for you and how you're feeling. Your own personal wellness is so important. Make sure you often talk to somebody or seek some advice about the opioid overdose. It's so important. Now, I'll share my screen again quickly. So how do we get naloxone? Okay, so naloxone is readily available in the community. There is 2 programs in Ontario, the Ontario Naloxone program, which is done through public health, and then the Ontario Naloxone program for pharmacies, which we can give out naloxone to anybody for free, okay? Ontario is lucky to have nasal Narcan coverage for free. You can also be anonymous in Ontario. You don't have to tell me who you are. I will be reaching out with everyone on this call through email, hoping that you guys will want naloxone. All I need from you then is your complete mailing address because of FedEx, and also preferably an email address, which I already have, to be able to attach that to. I will send you 2 Narcan kits in the mail with my black information sheet. It's coming out to you guys, okay? The other option is people can go to naloxonecare.com and get trained. So if you have a loved one, family, friend, client that you want to get trained on and see that video, go to naloxonecare.com and get trained. After you get trained, there's an option to answer a few questions. And then you put in, if you're an Indigenous person in Canada, you can get it fully covered right across the country. In Ontario, you can then just click the link saying Ontario resident, and we'll actually call you for information, make sure there's no other questions. I can send you kits. But everybody on the call today is automatically getting them sent to them if they want them. I will reach out after the conference. It's so, so important. Okay. And you can have 2 kits every single day you're alive. Okay. There's no limit. The government of Ontario feels it is actually more important to everyone getting naloxone than treating the overdoses that we're treating. And if you don't believe in my harm reduction philosophy, if you don't really truly understand what I think is true about harm reduction, keep people alive, to give them a chance to get better, and you just say, Mark, you're full of it. I don't believe any of that. And you want to just be motivated by your own tax dollars, it is cheaper to get naloxone than to treat one overdose. It's cheaper to get everyone in Ontario a naloxone kit than treat the $17,000 overdose that it costs. Okay, so if that motivates you, whatever, as long as you get Narcan. And the last thing I always leave with people to have this philosophy before we actually get the questions is ask not why the addiction, but why the pain. All right, thank you guys very much. Is there any questions?
So I will take questions in the Q&A. If anybody's got any questions, you can pop them in the Q&A. Thank you, Mark. That was very helpful and informative. And encourage everyone on the call to reach out and get those kits.
As well, I will let you guys know that this year is actually, does have an expiry date. It's stable from +5 to +40. It's really not practical. So what we say is that it's stable for 28 days. If it's frozen and thawed. That information comes from University of Waterloo. So if you keep it at the cottage or in your car, then just replace it once a month. And we can do that for you. No problem. It's very easy.
Super, super. So I'm not seeing any questions. I'm seeing a few thank yous.
Long day, I get it. And listen, this doesn't stop the conversation as well. You have my email. Email me if there's any questions, guys.
That's great. Thank you, Mark. Much appreciated. And
my pleasure. Thank you so much, guys. And I hope you guys enjoyed your 2 days.
Yeah, and thank you to everyone who joined us for this really important training session and for our conference. So a big warm thank you to everyone, and I hope everybody has a great weekend.